Yeah, so my interest in sports injuries obviously came from some rather too close personal experience with sports injuries. Um, I had a back problem that was bothering me for a few months, and eventually it was a judo coach who said to me that, yeah, you need to go and see this guy. And I went to see him. He's an osteopath, and he looked at me, got me to bend one way, bend the other, put his finger on my back, and went, "That's where your problem is." Did a couple of things, went away, problem went. So that was like I'd been in pain for. I mean, it felt like months. It might have been weeks, but within a few days, that things settled down. And I was like, "This is like magic." I don't know how it works, but I want to be able to do it. And that was my initial interest. And obviously, when you're training, you have little niggles yourself, and you have teammates who have little niggles. And a lot of the people out there treating sports injuries don't really understand the sport. So they can diagnose the injury. When it comes to, well, how do I get back and do this again?
Yep.
They'll just look at you like you've grown another head and say, well, maybe you should think about not doing that.
Yep.
Which obviously isn't the answer you want to hear. So I started doing my own reading around the subject and, about rehabilitation and injuries and, what to do with them. And, maybe started almost creating some of my own little rehab programs for myself and a few of my teammates. And then I started thinking, you know what, I want to do this properly. I don't want to be just sort of trying to fudge it from things that I've read on the internet. I want to start at the beginning and learn how to do this. So that was when I think my first step was to do a sports therapy course, and that was really useful actually. There are still things that I learned on that course that I use to this day. And again, that was one step, but that sort of opened my eyes to how much I didn't know.
Okay.
And I was also aware that injuries aren't something that only happen to combat sports people. They happen to all manner of people, and
Yep.
family members and who have been suffering from back pain and hip pain, and as you say, just as a function of getting older, really. And I started thinking, well, actually, I want to be able to deal with some of these things as well. My interest sort of broadened out from what I was originally focused on. It's mission creep, I think they call it. And that's when I decided to go back to university, and I bit the bullet and signed up for a 5-year course to become an osteopath. And that was actually, that was a really good move on my part. I'm really happy that I did that, because now that I love my job. I get people who come to me, they're in lots of pain. Sometimes it's sports people, sometimes it's people who just want to be able to play in the park with their kids or their grandkids.
Yeah.
And it might be somebody who needs to be able to lift things for their job and they can't because their back hurts. So it's having those people come to you and being able to do something about it and give them a bit of hope and give them a plan to go away and this is how we can get this better. It's just immensely rewarding, and that's what gets me out of bed in the morning these days.